out on a rainy day. We're so glad you're here. My name is Noreen Holmes, and I'm the director for La Crosse County Aging Unit. I'm one of the people who helped put this together. And the reason we wanted to do this is we're just so happy that there's so many people interested in the changes and the proposals that are being made for Social Security and Medicare. They're such important programs, and we know that there's a lot of confusion about what's being proposed, why does it matter, how does it affect me, the senior citizen, how does it affect all of us, because it does affect all of us. So what can we do about it? So what we hope is that today will provide some education and information that will help you better understand what the proposals are and how they will affect all of us. Several organizations helped in bringing today forward. Everyone is an advocate for aging issues, and they will introduce themselves and their organization and give you a little information about who they are and what they do. One of the things that kind of drove me to get involved with this, I have a mother who's 94, lives in her own home, and is inside quite a bit, so she watches, in my opinion, a little too much on the news shows. And so she'll say to me, "Whoa, are they going to get rid of my Medicare?" And I tell her, "No, don't worry, your Medicare will be fine." I kind of cross my fingers a little bit when I say it because I know some changes are coming. But I think what we can do here today is maybe be informed enough so that we can be in contact with our legislators to let them know how we feel, what we think, and what is the impact of what they're proposing. Because sometimes I think they're not quite aware of where the rubber meets the road at the grassroots, how what they decide will affect people. So we have Lauren Kannenberg here from U.S. Representative Ron Kine's office. We also have John Mettinger from Senator Tammy Baldwin's office. And they will be talking at the end and answering questions, and they'll be bringing back information from this meeting to their bosses, who are the exact people that we want to know what we think and how we feel. Regarding Social Security, now this is my own opinion, but I'm not the only one with this opinion. Social Security has so far not contributed a dime to the deficit. So I think it's a good idea to separate Social Security, and it's such an important program. Let's spend a lot of time exclusively on Social Security so that we can give it thoughtful consideration and hopefully not rush through some changes during this deficit reduction package. It's important enough to stand alone. Well, and with that, I would like to turn the podium over, or the microphone, I guess, to Billy Freitlinger. Did you want to sit down still?
Yep. Can people hear me back there? If you can't hear me, you'll raise your hand. Because we'll...
Oh, do you have one?
Yep, I got it here. Yeah.
Oh, okay.
So please feel free to raise your hand if you can't hear from me. My name is Billy Freitlinger, as Noreen said. I'm the executive director of the Wisconsin Alliance for Retired Americans. And we're an organization that started back in 2005. We're a nonprofit organization that provides public education and advocacy with people like yourselves and other retirees around the state of Wisconsin as it relates to state and federal programs that impact your lives and your family's lives. And so today we're going to really talk about two things. One, the whole issue of Social Security and the kinds of proposals that are being considered in Congress in addressing the federal deficit, and then Medicare, as well as the impact of the Affordable Health Care Act, sometimes known as Obamacare, on Medicare. So before I actually start getting very specific about Social Security and Medicare and the Affordable Health Care Act, I just want to start out with some general themes. So in case I forget something when I'm talking, you'll at least have the notion of the following things. When the downturn of the federal government in terms of the economy in our country, there were several reasons why we're in this predicament today in terms of the federal deficit and debt. Now also, just to make it real clear, yesterday I just saw on TV just recently that the deficit is being reduced even more so than it was originally projected to. We're not saying forget about the deficit, but we think the number one priority of our government is to help working with the private sector for jobs. Ultimately, that will be the way we turn around this deficit and debt. But there really are several reasons why we're in this predicament. One, we had 2 wars that were never paid for. We had 2 of the largest tax cuts in the history of America, over half of it going to the wealthiest Americans and large corporations. We have double-digit health care costs, not just the fault of Medicare beneficiaries, the entire system of double-digit health care costs. We had the worst economic downturn, a housing collapse are the main reasons we're in this predicament today. And as I said before, we're actually making some progress. We're not making it fast enough. No one in Congress, the President, would say that we're moving along fast. But those are the major reasons why we're in this predicament. Did you ever hear the word Social Security in the predicament? Like the financial? No, you never heard that. Going back to Noreen's point, Social Security has not contributed 1 penny. She said a dime, I say 1 penny of the federal deficit. Now some in Congress will say that's not true. We have to pay back the interest on those treasury bonds. Well, that's sure not the fault of this hard-earned benefit of people like yourselves in this room today. That's a problem that Democrats and Republicans took money from the trust fund and used it for other purposes. And in fact, your trust fund has a surplus of $2.7 trillion. And by the year 2020, and this is not me telling you this, this is the actuaries from the Social Security, you will have a $3.1 trillion surplus. Now it is true that the amount of money in the last 2 or 3 years, because of the economic downturn, is coming, less money is coming in through the FICA contributions than going out for payments, benefits. 100% benefits. Never been a problem since 1935. But what's not true is because of the amount of money in your trust fund, the amount of money that's accrued from interest, there is more money in your trust fund than having to worry just about the less of the amount of money coming into the system through the FICA contributions. So when someone tells you, well, the problem is already happening, it's just not true. Interest accrued in your trust fund is helping make up that difference of the money that come into the system through FICA contributions. And in fact, your trust fund will remain solvent until the year at least 2033. That means everybody in our country who's on Social Security up to 2033 will get 100% contributions. After that, it will be 75%. But my organization, the Wisconsin Alliance for Retired Americans, does not believe we should the federal government should do nothing. We agree something has to be done. But it should not be in the context of the budget process. Why? Because as I said before, it has contributed 1 penny to the federal deficit. So yes, we should have that discussion because we want to make sure our kids and our grandkids have this great program called Social Security. And some in Congress want to privatize Social Security. Some people in Congress want to increase the retirement age to 70. Well, I'll give you an example. A few months